Good afternoon, sir. I am actually Briones, your student nurse, and today I am going to do the male assessment. The purpose of this is to identify problems with your genital areas. So, next thing I'm going to do is to provide hand hygiene. Assuming na lang po na this is an alcohol. Provide client's privacy, and the last is to gather the equipment. Okay, so let's begin with the penis. First, I need to inspect the base of penis and pubic hair for growth, pattern, and infestation. Okay, so inspect. So the second is to inspect the shaft for rashes, lesions, or lumps. Okay, so the next is to palpate the shaft for hardened areas or areas of tenderness. Okay, so the shaft is smooth naman po and wala naman pong tenderness. So next is I will inspect the foreskin for color and location. Okay, and the next is to inspect the glands for size, shape, lesions or redness, and the location of the urinary hiatus. So the shape is acorn shape, and the location of the urinary meatus is slightly ventral to the tip of the penis. And from size yung patient, you need to ask him to retract his foreskin. Next is to I will palpate for discharge. So okay naman, wala namang discharge. The scrotum. First, I'm going to inspect the size, shape, and the position. Okay, so this shape is like set, and the position naman po is under the penis. Okay, so next is I will inspect for swelling or lumps and lumps. Okay, so wala namang swelling or lumps. Okay, so third is I will inspect the skin for color, integrity, and the presence of lesions or rashes. Okay, so I will lift the sack to examine the skin under scrotum. So next is I will palpate the scrotal contents for shape, consistency, and presence of tenderness or no. So next is to transilluminate the scrotal contents if swelling or mass was noted, pero since it's all normal naman po, I will not transilluminate. The next is the inguinal area. First, I am going to inspect for inguinal and femoral hernia, watching for bulges while the client bears down. So next is I'm going to palpate for inguinal hernia, observing for bulges or masses. Okay. Okay, so next I'm going to palpate for femoral hernia. Okay, so wala namang bulge or masses. Okay, so the next one is the anus and perianal. Okay, so the first thing I'm going to do here is to inspect for lumps, rashes, or lesions, and with redness. Okay. Next is I will inspect the sacrococcygeal for swelling, redness, dimpling, or presence of hair. So, okay. Okay, so next is inspect rectal prolapse with Valsalva maneuver. So, sir, I need you to take a breath, and after 15 to 20 seconds, you need to push up breath and strain it. Okay. Next is I will palpate for anal sphincter tone for tenderness, nodules, or hardness. Okay. So the last is the rectum and prostate. So first, I am going to palpate the rectum for tenderness, irregularities, nodules, and hardness. So next is I will palpate peritoneal cavity for tenderness, or nodules, or rectal shock. Okay, so next I am going to palpate the prostate gland for tenderness, size, shape, texture, and irregularities. Okay, so the shape is like inverted cone, and the texture known po is smooth. Okay, so the fourth one is to inspect the feces for blood and perform both blood tests. So the assessment test is done, and um, the next is the analysis of data, formulate nursing diagnosis, and formulate